All right, we are live. We are live. Welcome, everybody. Thank you so much for joining us. I have such a treat for you today. But before we get into that, introductions. So, I am Dr. Ude. For those that don't know me, I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care and aesthetic practice. And my goal is to have my patients not only feeling good, but looking good. So now to get into what I have for you today, I have a special guest, Dr. Okogbaa. Thank you so much for coming in to see us today. So a little bit about Dr. Okogbaa. She's a board certified ophthalmologist based in Baton Rouge, Louisiana. She's been there since 2013. She's the CEO and founder of Louisiana Center for Eyes. So Dr. Okogbaa, thank you so much for joining us. It's such a pleasure.
Thank you so much, Dr. Ude, for having me on. Really appreciate it.
Yay, this is so exciting. So, we have a treat for you today, guys. We're going to be talking about diabetes and how it affects your eyes. And I have the expert here today. So, Dr. Okogbaa, I know you deal with this on a regular basis in your practice. What would you say are the big things that diabetes does to the eyes that you want to educate our viewers?
Wow, diabetes is such an important topic because we have
Yes.
individuals who have that condition, and it's one of those things that can really impact the eyes. So, what we know is that diabetes is actually the leading cause of vision loss in
Yes.
individuals between the ages of 18 to 64. So if you're basically
Yes.
going to have vision loss from something, likely chance
Mhm.
is going to be from diabetes.
Yeah.
The minute that they're diagnosed with diabetes with their primary care doctor, next appointment is to see the eye doctor just to make
Mhm.
sure that it hasn't already impacted the eyes.
Gotcha. And I mean, I'm pretty sure there's a lot of things that you do for patients once you see them in your office, but can you guys just kind of give us a brief overview of what to expect when they come see you and what you're going to do for them?
Yeah. So I think one of the things that we recommend is definitely you want to get an annual eye exam as a diabetic, and then if there's anything going on in the eyes, then we need to see you even more frequently because it can silently comes or silently cause damage without even knowing. And so when you come in to see the eye doctor, of course, we do what we call a comprehensive eye exam, where we literally go from front to back because diabetes can cause many things in the eyes. Some
Mhm.
people can even have symptoms of blurriness when their sugars are elevated, and one of the symptoms they'll have is actually my all of a sudden I have blurry vision. Well, it's because your
Mhm.
sugars are now 300 or 400, and so
Mhm.
it can you can have acute symptoms, and you can have symptoms that are from long term effects as well. So with the comprehensive exam, we go from front to back. We look at every structure of the eye. We also check the pressure because diabetes can double your risk of getting something called glaucoma. So we also
Yeah.
check pressure in the eyes. We look
Mhm.
for things like cataracts. Again, that's one of the things diabetes can
Yeah.
in the eyes is it causes you to develop cataracts earlier.
Mhm. Mhm.
And then we
That
go to
is
the back
amazing.
of the eyes, the retina.
Mhm.
We'll
Mhm.
we call it a dilated exam where we put drops in the
Mhm.
eye, dilate the eyes so we can have a better view of the back of the eyes. So one of the biggest things that diabetes over time can do to the eyes, it because all it does is all that extra sugar or glucose in the bloodstream
Mhm.
literally damage these tiny vessels that we have. And because the eyes have so many of these vessels, one of the first places that if damage is going to happen in your body from diabetes, it's the eyes. And so some people
Absolutely.
develop what we call macular edema, where they
Yeah.
start to develop swelling in the back of the eyes. They have
Mhm.
hemorrhages, or we call
Yes.
diabetic retinopathy, or they can start having just abnormal blood vessels, um, building up in back of the eye. So we do the exam to look for that. And so that's why it's so important to have an annual eye exam in addition to partnering with your primary care doctor to make sure
Mhm.
the A1C stays under control, your cholesterol, blood pressure, all of that stay under control, because all of that will also help keep the vision going as well.
So you guys, you heard it from the eye expert. I'm always telling my patients, when I had newly diagnosed patients, even my return patients, I'm always trying to make sure that they get to see their eye doctor. And the other one I do is their foot doctor. So you've heard it from the expert. I didn't make that up. So you need to get in there and see them at least once a year. Now, what tips you kind of started getting into that, but what tips do you give patients from your end to keep their eyes healthy? From your perspective when
Yeah,
you before you send them on their way. Mhm.
yeah. So the big tip one is do not miss your appointments with your eye doctor or your regular doctor. Uh,
Mhm.
we're always keeping the glucose, the A1C under control. So what I tell my
Okay.
is you got to know your number. Okay,
Yes. Mhm.
your A1C, we need that at 6. Okay, so the lower the
Mhm.
A1, better. The less complications you will get.
Yes.
Diabetic
No
retinopathy,
sugar.
all the problems that comes with the eyes. So the next
Mhm.
tip is to also monitor your vision. Whenever something is not right, you need to go see
Mhm.
eye doctor. So start having any sudden changes in the vision, where the vision now all of a sudden it's blurry, or you start having extra floaters going on, dark spots in the vision. It could be a vitreous hemorrhage, distorted vision, anything out of the ordinary. Very important to monitor that and make sure you don't sit on that, and that you go see the doctor. And then, of course, you also want to keep up with your other numbers, such as your cholesterol and your blood pressure, keeping those things under control. So those for folks.
That is awesome. So the top one is just that sugar number. I'm always stressing they can keep the sugar number under control, then it keeps all these complications. Eye obviously is a big one, kidney is another one, neuropathy is another one. It keeps all those things at bay. So thank you so much, Dr. Okogbaa. I actually wanted to do it in reverse, but I think I was really excited about the topic. So we're going to switch gears just so that we get to know a little bit about you. So I usually ask, I mean, we know you're an eye specialist and we know where you are. The other question I would ask is why you do what you do. What motivates you to do what you do?
Wow, I
It's kind of
love
like putting on this. I know, right?
that. Medical. I really wasn't sure what area that I wanted to specialize in. And then I had a mentor who was actually an ophthalmologist, and I started
Oh,
community with her. And one of the things
okay.
I'm doing is actually going to churches and community centers and actually doing what they call glaucoma screenings. And for some reason, I just
Awesome.
fell in love with that, because we were literally saving eyesight by just doing a screening. And,
Yes.
and I just completely fell in love with that, and I decided to do my residency in medical and surgical aspects of the eye. So
That's
now
awesome.
individuals, reach their best vision potential to keep their lives
Mhm.
going, so that they don't lose their jobs, so that they can keep driving, so that they can keep doing their hobbies and all the things that requires us to have good eyesight. And so that's my
Right.
passion, and I love doing it every single day, either it's
That's
surgical,
amazing.
medical, or just some good glasses or contact lenses. Yeah,
Awesome.
takes to make those eyes reach their best potential. That's what I do.
That is so awesome. Your service is well needed and well appreciated. Thank you so much for what you do. So let me see here. So you guys have heard it from Dr. Okogbaa. So definitely make sure that you're seeing your ophthalmologist. So Dr. Okogbaa, if people are looking for to see you or looking to learn more about you, can you let us know where they can find you?
Yeah, so I'm located in Baton Rouge, Louisiana. So if you
Mhm.
happen to live in that area, come on by, give us a call, find us, Louisiana Center for Eyes. I'll be happy to work with you, get that vision right. You can
Okay.
my website, www.drokogba.com. lacenterforeyes.com, or just for more eye health tips and information, you can follow me on Instagram or Facebook at LA Center for Eyes. So,
Yay, this is so fun. Thank you so much for being here with us. And I'll include that also, your contact information also with this video once we put it up. But thank you so much for coming. So everybody, I tell you it was going to be amazing? Thank you, Dr. Okogbaa. So for everybody, you know where to find her. We'll put the information in. And then for those of you that are looking for primary care, you can look me up at www.apple Valley Family Medicine, or give us a call at 304-350-1087. And I will see you same time next week for our next episode. Bye.
bye.
Bye.